think one thing that people might have heard about psychedelics is that it's like 10 years of therapy all squished into, 1 day of treatment. And it's kind of shocking to think like that. But I do think that's what a lot of people who take psychedelic medicines have had this experience, that their whole life has changed. And they might have been talking about this issue with a counselor or a therapist for years beforehand. And finally, they find the truth inside of themselves, just with the assistance of a psychedelic plant ally. Probably most people have heard of psilocybin or, magic mushrooms, maybe the more common one. But there's a bunch of different psychedelic plant medicines or earth medicines. Today, we're going to talk a little bit more about Ibogaine. So I want to speak about that one a little bit today. You might have heard of ayahuasca. Ayahuasca and Iboga are often called the master plant teachers because they're really quite powerful, and they can induce really powerful visions. They can help you deal with past trauma, see your truth for what it is. Very intense. So I would say out of the two of them, Iboga is probably even the most powerful. Iboga itself is a plant, a shrub, and the actual medicinal part of this shrub is actually found in the bark of the roots of this Iboga shrub. So it's pretty crazy that humans have even discovered this. Within that root bark are, a whole bunch of different alkaloid molecules that are psychoactive, but the one that's present in the highest concentration is called Ibogaine. And that's what is often purified and used. That's what we use here at the clinic. Ibogaine has a whole bunch of benefits for the brain, the body, and the energetic mind, right? The soul and the mind. And I think it's hard to really put all of these into categories and say what is the medical effect of all of these different alkaloids or of Ibogaine itself. But one thing it's really good at doing is healing trauma and dealing with addictions. And so how does it do that? I think that the simple way that I often explain to people is that it kind of resets all of the neurotransmitters and the neurons. So it rips out the neurotransmitters from their receptor site so that everything is like a clean slate all over again. Think about people who are taking antidepressant medications. What those medications are supposed to do is like block the reuptake of serotonin so that you have like more neurotransmitter in between the two nerves, the upper nerve and the lower nerve, and that's where all the neurotransmitters hang out. And the thought is if you don't have enough serotonin, then you feel sad, like depression, right? So those medications block the reuptake of the serotonin, providing more of it in there, so making you feel better. That's the medical science of it. I guess we kind of know today that they don't all do all that great, but in a way Iboga or Ibogaine does something very similar, but for all nerves and all different neurotransmitters. So it doesn't really it blocks something, it actually just resets all of those neurotransmitters. So I think you feel like you have more of a mental clean slate. Everything is fresh. No. Works for a lot of different addictions, maybe not even a true addiction. My own self, I'm a medical doctor, American originally, and I escaped to Canada where I live now. But about 5 years ago, I left the hospital system and retrained in lifestyle medicine and do a lot of work with psychedelic medicines too. And so I think, this is something that is emerging and really powerful for humans to experience, and we don't have a lot of language around it in conventional medicine to really explain what's going on. That's why we want to study it more, right? We have more people who are taking it and really examining their experiences, not even so much to explain it from a purely medical or scientific standpoint, but to see what it really does for real humans and their mind and their connection to the divinity inside of them, right? In my past, I've been a scientific researcher and I've done a lot of trials at the hospital. We focus so much on the science But when it gets really right down to it, it's a plant with a spirit and a human with a spirit. And it's those two spirits interacting, which really cause the magic to happen. And so I think, how am I going to play a role in like helping humanity with these plant medicines? My role is to be a mirror for other people, to be so clean, my own self, my whole mirror is cleaned off so someone else can actually see their own selves, right? And plant medicine, I think, is just a beautiful ally for it. I think one of the reasons why I've been able to be such a strong proponent for plant medicine is that, you know, the biggest transformative experiences of my own life have happened without plant medicine. So I know that it's me who does the work. Ultimately, it's like my consciousness that does the work. And I can see how plants can be such strong allies for us. They're not like, let's say, a shortcut for doing the work. You still have to do the work, right? And if I can help people do that through the being that I am, then I think that's how I am actually my role as a healer. The person heals themselves, right? I'm just a catalyst. I've heard this question repeatedly from clients taking Iboga or Ibogaine. We often ask them to have a screening ECG or EKG, which looks at their heart function. And so some people will ask, like, oh my goodness, is Ibogaine or Iboga bad for the heart? And so I wanted to be really clear about that. This plant is not bad for the heart. It's that it can change the function of the heart cells just temporarily. So the amount of time that it takes from when the heart beats, all the cells have to depolarize electrically in order to beat. Well, then they have to repolarize and get ready to beat again, right? So it's that period of time that the heart takes to get ready to beat again. That's the period of time that we really care about and we look for on the ECG, because Iboga or Ibogaine also prolongs that time. So there's a few people who are taking medications, or maybe genetically, they have a long interval of time just naturally that the heart takes to get ready to beat again. Now, if we give them Ibogaine, that interval prolongs even a little bit more. So it's a theoretical risk that the heart might be taking too long to get ready to beat again, and that could be dangerous. So it's all very theoretical. All of those from, the studies that I've read, all of those changes in the heart cell function go away within 24 to 48 hours. And that's been tested to see that people's heart return totally to normal. So Ibogaine is not bad for the heart. It's not toxic to the heart. We're just looking for one specific thing that could be off in the way that your heart beats, and that's it. Another question that someone might have is about Iboga versus Ibogaine. We talked about how Ibogaine is the main chemical compound in Iboga, and that's what does most of the work. And so some people might wonder if Ibogaine is synthetic or natural. Some people are trying to only take natural plant medicines and stay away from the synthetic things, right? So although Ibogaine could possibly be manufactured synthetically in a lab, what we are doing with this one is we actually take the plant and then we purify and do extracts of the plant to create the Ibogaine. So it's not actually a synthetic compound, it's still a compound that's extracted from the original plant. So I would still consider it a natural product. I think each person has to consider what they feel safe with and what they're looking for. Some people are way too nervous to start with a plant medicine retreat right away, or have hours of being in the medicine space, like with Ibogaine or LSD or Ayahuasca or whatever, right? And maybe they would opt to go for Bufo first because it's like a very quick and powerful experience. They might feel more safe to do it that way, right? Just for the timing thing. Some people want to be like held and taken care of for a week and have a whole week-long experience to really work on themselves. And it's just what resonates with each individual person. Ibogaine and or Iboga, I think it's very well suited for people who have deep trauma that they might not be able to like consciously work through in their mind. Also, PTSD, that's another type of trauma that's like really embedded into us. And addictions, of course, do really well with Iboga as compared to the other ones. Yeah, I think part of the reason why people with addictions do so well with Ibogaine or Iboga is that the main metabolite of Ibogaine is called Ibogaine, and that metabolite is actually stored in our fat cells and can be hanging around in our body for like a month or more afterwards. It's one of the things that everyone talks about. The benefit of psychedelics really is taking down the default mode network in our brain and then increasing neuroplasticity and all these growth factors for our neurons and the brain, right? And so if we can prolong that window of neuroplasticity, that you can actually really be integrating and doing the work on yourself and changing your brain for the better, well, I mean, Iboga is great for that, or Ibogaine is great for that, because the metabolites stay around for so long and help you continue to do that work. Particularly at this treatment center, I'm really impressed by the fact that it blends clinical and ceremonial styles together. So Ibogaine treatment is definitely a treatment that, you need some medical practitioners around. You shouldn't be doing this at home by yourself with something you ordered on the internet, right? So I'm going to want to find a great treatment center, which this is. There's doctors and nurses who are around. There's lab tests, there's clinical monitoring during the treatment, and IV therapy and everything to help you out, like very, very, has all the clinical bells and whistles that you would want. But then at the same time, it's not a sterile, white hospital room and whatever. The ceremonial aspect is still here, which I think really honors the tradition of this African medicine and makes it more powerful for the soul when we honor the spirit of the medicine. So it's a little bit of both here. And I think for people who are looking for a little bit of both, not too crazy clinical, but like enough, and then still the ceremonial side of things, I think you'll be really happy here.